Cabbage generally contains many bioactive compounds with medicinal properties. These substances often range from polyphenols, vitamin C, carotenoids, and glucosinolates. Traditionally, cabbage has been used in medicine to treat or manage different conditions. Stomach ulcers remain one of the many diseases cabbage and cabbage juice have been shown to treat in the traditional sense. Even so, there is some contention about whether cabbage juice can actually help treat or manage stomach ulcers. This debate comes in the wake of growing interest in cabbage as a natural and home remedy for ulcers. According to multiple studies carried out to determine the effectiveness of utilizing cabbage to treat and prevent ulcers, there is a consensus that taking cabbage juice regularly can lead to positive outcomes for people with different digestive ulcers. In one study involving 13 patients with peptic ulcers, treatment with fresh cabbage juice led to faster healing and effective symptom management. As noted, patients only needed about 10 days to heal their duodenal ulcers with fresh cabbage, even as standard therapy took 37 days. On the other hand, gastric ulcers healed in just 7 days with cabbage juice intake, with standard therapy taking 42 days to achieve the same results. In a different study, cabbage juice significantly reduced the ulcer crater healing time relative to standard diet and prescribed drug therapy. Patients also experienced symptom and abdominal pain relief following treatment with raw cabbage juice, vitamin U. These studies demonstrate that taking fresh cabbage juice regularly helps treat peptic, gastric, and duodenal ulcers. The therapeutic benefits attributed to the intake of fresh cabbage juice show that it has anti-peptic ulcer properties. The glutamine in cabbage juice might partly explain the positive results among patients with stomach ulcers. Cabbage juice usually provides a significant amount of this organic compound. Glutamine is generally an amino acid with anti-inflammatory and anti-ulcer properties. It further serves as a substrate for the cells found in the intestinal lining and protects them against stress and death.
Cabbage juice is also rich in vitamin C, a potent antioxidant that facilitates stomach ulcer healing.
Vitamin C also reduces bleeding or hemorrhage risk in people with peptic and gastric ulcers, promoting healing. Cabbage juice further contains p-coumaric acid, a naturally occurring polyphenol compound with antioxidant and anti-inflammatory properties. As a result, this compound is capable of accelerating gastric healing in patients with stomach ulcers. In addition, cabbage juice has caffeic acid, another phenolic compound with potent antioxidant and anti-inflammatory activity. These properties promote ulcer healing and protect the gastric and intestinal mucosa from further damage or ulceration. Cabbage juice also improves digestive activity by stimulating gastric acid production. As a result, it accelerates digestion, preventing the buildup of disease-causing bacteria such as H. pylori, which often contribute to ulcer development and exacerbation. In addition to stomach ulcers, cabbage juice promotes the treatment of gastritis and related abdominal pain. Camphorol and glucosinolates generally play a critical role in this approach to gastritis management. Their antioxidant and anti-inflammatory properties significantly help manage this inflammatory condition. These bioactive compounds and others further protect individuals against H. pylori bacteria, which usually causes gastritis and stomach ulcers. Fermented cabbage, sauerkraut, juice can equally help in treating stomach ulcers. It follows that this juice has anti-helicobacter activity, with its high probiotic content improving the gut microbiome in favor of the good bacteria. Even so, a high salt content is usually a concern owing to its detrimental health effects.